Hello, this is Dr. Gay from First Second MRI, and this is a 41-year-old male who had an ACL tear. He had a repair. They put in an ACL graft, and the ACL graft goes obliquely here from the back of the femur to the front of the tibia. And the graft, there should be a nice big dark band coming obliquely like this, but instead we don't see a dark band. We see just gray material. So this looks like a re-tear of that ACL graft. Sometimes they'll take part of the patellar tendon here that comes off the kneecap down to the tibial. They'll take that out and put it in, but this patellar tendon looks pristine, so it does not look like they've used that as a graft. Sometimes they'll take a tendon up here, the quadriceps, or other tendons, and sometimes they'll use a cadaveric ACL. But in this case, the graft, whatever they put in there, is retorn. We do see this gray signal here. There's a couple other interesting things in this patient. Up here there's a round area of darkness. This is the femoral tunnel. This is where the ACL graft plugs in, but instead of being nice and clean and sharply defined and small, it's large. So this is cystic expansion of that ACL tunnel. They had a degenerative signal, maybe even mucinous material that has extended in there and expanded this out. And this will make this ACL graft loose or unstable. Again, this is totally torn in this patient. Also down here in the tibia where it plugs in, we see this dark area here. This is an anchor that holds the ACL graft in. And we see that there's a big cavity around it, which is abnormal. So this is a big fluid pocket filled with fluid or synovial inflammation, and the fluid protrudes out of the bone here in front. Very unusual. It's not terribly unusual to have cystic expansion of these femoral and tibial tunnels. These ones are very expanded, and again it has a tear here, and to have the fluid protrude out here anteriorly is pretty unusual as well. Now there's one other thing. We see a dark band down here, and we don't see the graft up here, so it looks like the graft is migrated down through this large tibial tunnel, and it's down here in front of the knee. And we can see that probably better on this view. This is a view where fluid and inflammation look bright. So the ACL graft, which we should see here, we don't. We just see this little tiny band of it, but the bulk of it is torn. And we're going to look down here at the tibial tunnel, which is really expanded with that fluid or inflammation. And we also see this fluid pocket that comes out of the tunnel, and it goes here into the subcutaneous soft tissues in front, which is pretty unusual. And then we see this outlined by the arrows. This is that graft that looks like it has migrated out from here, is torn, and now it's either drifted down or maybe flipped forward, and it goes down here in front of the tibia. We can see this on another view. This is called an axial view, where we see the kneecap up high. As we go down through the knee joint, we're going to see the femoral tunnel here is expanded. The ACL graft should be here. We just see these areas of speckled darkness in this bright material, which is that fluid and inflammation. We don't see a nice clean graft. As we go down below the knee joint down to the tibia, we see this expanded tibial tunnel with this funny fluid that's coming out of the tunnel into the subcutaneous soft tissues. This is the patellar tendon. And now we're going to go down a little bit lower, and we see this. This is that ACL graft that is migrated out, and now it lies down here in front of the tibia and the leg. So a very unusual case of a re-tear with the graft migrated down in front of the knee. And that's it. Thank you very much.